Thank you for watching the first part of our IBS informative sessions. The second part today will be about associated conditions and signs and symptoms of IBS, delivered by Dr. Neville Azzopardi. Thank you for watching.
We know that IBS tends to be associated with other conditions, in particular chronic fatigue syndrome, fibromyalgia, temporomandibular disorders, and stress. All of these are conditions which tend to be associated with increased stress, but blaming it just on stress is probably too simplistic. The big question is this: are these patients stressed because they have IBS, or is the stress causing the IBS? And this is the same thing with all the other conditions. And this is one reason why I don't like the term functional disorder, because the real reason why we call most disorders functional is because we don't know what causes them. We can't explain it, and we don't have a test which actually shows IBS. So it's not like when you see a polyp at endoscopy, which is obvious, it's there in front of you. What you have here are patient symptoms. And explaining those patient symptoms with normal investigations is frequently not easy. The most important thing is obviously not to mistake IBS for something else. IBS is frequently diagnosed just by taking a history, and you don't always need to do investigations. However, if a patient complains of blood mixed in the stools, that should get you thinking. This is not the same as bleeding PR. Fresh bleeding PR, particularly in constipated patients or patients who have a lot of diarrhea, maybe normal, it might be coming from hemorrhoids or from perianal fissures. But blood mixed in the stools, that's worrying. If there are family histories of bowel pathologies like celiac, colon cancer, inflammatory bowel disease, that's a red flag sign. Fever should not be present in IBS. If the onset of symptoms occurs above the age of 50 years, it might still be IBS, but I would want to investigate by doing a colonoscopy. If there are nocturnal symptoms, now typically IBS does not present during the night. The symptoms aren't that bad during the night because the gut-brain axis is switched off. However, if a patient eats very late or eats a very large meal, which might be the trigger for the IBS symptoms, you might get 1 or 2 bouts of loose stools, particularly in diarrhea predominant IBS, during the night. However, typically nocturnal symptoms, which are recurrent, worry me because usually that's not something which is being caused by the IBS. It's something organic. Chronic diarrhea and progressive dysphagia. Obviously, if the dysphagia is getting worse, you have to investigate. If there's recurrent vomiting, if there's severe chronic constipation, and in particular, if the symptoms start, the etiology of the symptoms start over a short period of time and they continue to get progressively worse, there I worry. If there's travel history to locations, endemic to parasitic diseases, and probably the most important thing is weight loss. Patients with IBS do not lose weight until you put them on the FODMAP diet, which is associated with weight loss. But a normal patient eating a normal diet who is losing weight, probably this isn't IBS, but he's suffering from something organic, so you need to wear that patient up very well. On examination, things to look out for are abdominal masses, active arthritis, dermatological conditions like, for example, dermatitis herpetiformis in the setting of celiac or pyoderma cancrenosum, which tends to be associated with inflammatory bowel disease. If there is occult or overt blood on rectal examination, and clinical signs of pallor, intestinal obstruction, intestinal malabsorption, or thyroid dysfunction during examination. What are the signs of IBS? We know them, they are very typical in presentation, but probably the 3 commonest ones are the ones I put up in bold. So they tend to suffer from a lot of bloating and abdominal swelling, and I'll talk briefly on this as well. There tends to be abdominal pain and cramps. There can be abrupt changes in bowel habit. You might have loose stools for a week, and then the patient might be constipated for 10 days, and then they get loose stools again. Or patients might have just loose stools, or patient might be chronically constipated. Frequently, they complain of a sour taste in the mouth, increased need to urinate. This happens because there's so much bloating that the intestines are actually pressing on the bladder and therefore giving the need to the patient to go frequently to the bathroom. stool shape or form may be abnormal, stools may be watery or very hard. Frequently, the patients have anxiety and stress disorders, and they frequently complain of palpitations, fatigue, and acid reflux. Now, by fatigue, what we mean is that the patient complains of feeling very tired after food, after eating larger meals or particular types of meals. And they will tell you that, particularly for patients who have jobs related to computing, sitting down desk jobs, they feel so tired after they eat that they need to go to rest. They cannot concentrate. And the typical terminology that is used is called mental fogginess. It's as if they cannot concentrate on what they're doing until they sleep for a couple of hours. And then after which they start feeling a bit better. I put up this picture just to show you how bad the bloating can be. I'm sure you've seen this, but typically the two pictures on the right, they show the same person, 5 days apart. She's a model. She put up these pictures on Facebook, and I'm using this picture from her account. So the first picture, the picture in the middle, shows her on a day that she had a modeling session. The second picture is 5 days later, after she had stopped the diet, the FODMAP diet that she had been following for the previous week, and she went back to eating her normal foods. And you can see this is not fat, this is air, this is all gas in her intestine, and she's significantly bloated. And she tells patients that as soon as she goes back on the FODMAP diet, within 3 to 4 days later, her abdomen is back to the flat abdomen that you can see in the middle picture. And this is just to explain how much variation there can be in abdominal symptoms. Just one little thing. For today, we'll stop the presentation here. Next time, we'll talk mainly about who to investigate and how to investigate, and probably the most important thing, how to manage IBS, because IBS is a challenging condition. And management doesn't depend just on pills, but you really need to speak to the patient and explain what they can eat, explain the importance of exercise, and at times even psychosocial behavior. And unless you do all this together, the patient's symptoms will not improve. And I'll see you next time. Thank you. Finally, this is a talk which has been sponsored by Energast. A few words about it, though Rachel will be talking in more depth on this new drug. It consists of sodium butyrate. It has a number of uses. It's not just used in IBS. It's also used in diverticular disease. It's also used in patients with chronic diarrhea or traveler's diarrhea. And what it does is it replenishes the levels of sodium butyrate in the gut. And this is a compound which is essential for healthy functioning of the gut. And we know that in IBS, the levels of sodium butyrate tend to be low. It's a longish course of treatment, usually a number of months, but I've had a lot of patients who did improve with this drug. And being a very safe drug with no side effects, a bit like probiotics, I tend to use it first line before I consider other drugs which might have a bit more side effects. But I'll leave you to Rachel to explain a bit more about this drug and about how to prescribe it. Thank you.
Thank you, Dr. Neville Azzopardi. A few quick notes regarding Energast. Energast has been shown to reduce discomfort and pain in patients suffering from IBS. This study is a short-term, a 6-week, randomized, non-placebo-controlled study. In the bar graphs you can see there's a significant reduction in severity of discomfort and pain in patients taking Energast, and there was also a significant reduction in the severity of defecation disorders in patients taking Energast. Thank you for your attention.